I know it.
You don't mind if I record it?
No, go for it. I'll go put on my nice pants.
Yeah. Come out in a mankini or something like that.
Don't tempt me.
That's on the recording too. Alrighty.
Doesn't worry.
Good. So what we'll do, so we'll go on the fly here a bit. So we'll go through some run specific drills. So for running, so our assessments are going to be wanting to see what our ankle range is like, because the calves are going to take a bit of a beating. We're going to take a look at what the hips are doing and looking like. And then we'll just put it all together, I think, with either a toe touch or a squat. Oh, we'll do both. That'll be the easy way. So the first thing we're going to do, we're going to go a knee to wall. So your foot is going to be, you can see me all right there, Dom? Yeah. So your foot is going to be down, and what you're doing is you're going to see what the distance is that you can take your toes away from the wall. So I'm going to be sliding my foot away from the wall that direction, while keeping the foot flat and your knee contacting the wall. And you can, if you want, you can put like a little marker of where the toe is, or you can just remember it, because this will be our pre-test. To do that on both sides. Sweet. That's your test done. Cool. Next thing we're going to do, we're just going to go through a nice simple toe touch. So we're just going to go feet together. We're just going to go down, touch toes.
Can I bend my knees?
Keep them straight. Okay, so again, when you're down here, I want you to take note of what feels tight. Okay, so is it hamstrings, is it glutes, is it back of the knees? Because we're going to go through a few different things there. Sweet. We've set that in the memory bank. And then the last one we're going to do is we're just going to go through a squat. So just hanging down in the squat, seeing how the hips feel, what feels tight. If anything, moving hips like outwards as well in this position. So you can just have a feel of what areas are tight. And we can even go like with feet together now and just feel that way. So we'll go through a few different areas. Cool. Got them to memory?
Yep, good to go.
Sweet. What have you got? I should have run with this first. Equipment wise.
Ball, foam roller, pretty much everything.
Sweet. Let's go with the ball first. Okay, so we're going to take the ball. Oh, it's just in view, hey?
Yeah, I can see yours.
Let me tilt it down a little. There we go.
I'll move this as well.
Yep, cool. Okay, so you're going to take the ball. Ball's going to go right under the calf, just like that. Okay.
In the middle?
Yeah, let's start in the middle. We will change it, but we'll start in the middle. The other leg is going to be placed just on top. So the goal of this other leg isn't necessarily to put a lot of pressure down. It's more to just try and help stabilize the leg that the ball's on, just so you don't roll off the spot. Okay. I want you looking at the camera for this one, Dom, because this is going to be funny. So what you're going to do is you're going to bring the foot up as far as you can, and you're going to throw it down quick. Yeah. And you're going to do that about 5 times. I actually like having the microphone on, because now I can hear what's going on.
It's usually a difficult.
Yeah. And once you've done that about 5 times, then you're going to start to roll big circles. So you're going to go like 5 circles one way, slow, controlled. Yeah, and then we'll go 5 the other way. Sweet. So now we're just going to move it to a new spot. So whether that means like higher or lower than where you are, or what you can do is you can turn, I don't know if you can, like I'll exaggerate, so we can turn the ball towards the outside, or we can turn the ball towards the inside. So you can even you'll probably feel like where there'll be a little bit of tension. Once you've got that, same thing, plant the foot on top, go through the 5 pulls up slow, throw down quick. So these will be magic after the running.
Like,
It won't feel magic
good.
now. You're hating me now.
Good.
And once you've done the 5, go to big circles. The 5 one direction, 5 the other. Just really using that top leg to try and just keep it pinned. Sweet. And then we can jump onto the other side. I'll flip around. Yeah, so find that spot again. So we're going to do 2 spots again on this side. So find the first one. Once you've got it, other foot goes on top. So you're going to bring the foot up slowly. You throw it down quick. And as you do that, you'll just feel the ball sink in.
This leg's worse than the other one.
We've been running on one leg, have you?
Yeah, been hopping. Getting better.
Yeah, so we're going 5 one direction, big circles. Just trying to imagine that you're trying to get your big toe towards each corner of a square to cover all bases. And then once you go back the other way, the exact same thing. Sweet, and then we'll find a new spot. Sounds like you'll have many spots, Tom.
Like, no matter where I put this ball on my leg, it's hurt.
Just remember, it's not me, it's the ball.
Yeah, I don't believe you.
You can't show your pain face. I'm in excruciating pain right now, but I've got a smile on my face.
Show weakness. It's masculine these days to show pain, show weakness.
Not going to argue with that. Good. And then go 5 the other direction. Great. All right. So we're going to move our way up. So we're going to go the inside of the thigh, the adductor. So grab your foam roller. Okay. Roller's going to be down. Yeah, I think this direction will be easier to demo. So you're going to be lying to the side of it. And then what I'm going to do is I'm going to take my leg onto it. Make sure turn this way. Yeah, that way. Okay. So you're going to roll, so from like high up in the hip towards the knee until you find a spot that you can feel a little bit of tension there. So usually it'll be like towards the knee. Yeah, you got it.
I just put my leg on it. Body weight's enough to hurt.
Bingo. And so you can use the other leg that's not on the roller to just take a bit of body weight off, or let more body weight sink into it, whatever you want. Same thing with your arms. And once you find that spot on the knee, you're going to keep that position on the roller, and we're going to go through 5 bends of the knee. So what we're doing here is we're just pinning down the tissue, and we're just encouraging it, the areas around it, to just slide a little freer. So once you've done the 5 bends of the knee, we'll find a new spot. You can play around with position, so it might be more towards the front of the thigh, not completely on the front, still staying on the adductor region, so this region here.
Yep.
And then once you've got that spot, same thing, pin it down, and we'll go through 5 knee bends. Nice. Because this one's an easy one, we'll go 1 more, so we'll do 3.
Would you recommend higher up or lower down towards the knee?
Look, to be honest, it's going to be pretty individual. on me, for example, I don't really feel anything too high. Once I get about halfway, that's where I start to feel it. And then towards the knee, that's where it's a bit more. It'll be different for different people. Just go and feel. Like, you'll know by just rolling. Like, as soon as you roll, you'll find a spot. I'm like, yep, there. Keep it there. Bend and straighten.
I could be here for about 1.5 hours and still not get it all.
So lucky we're only doing 3 spots.
Thank you.
Really making sure you get the knee straight at the end of each one. And then we'll flip sides. Yep, so same thing, finding a spot. Once you've got it, bending and straightening the knee. Yep, and once you've done 5, we'll find a new spot. And last one, is move around, find a new spot. Once you got it, slow, bends and straightens to the knee. Nice. All right, let's grab that ball again. So we're just going to go through release through the top of the hips. So if we're tall kneeling, you feel like the front of the hip and you'll find that bony sort of spot. So you're going to go just to the outside, like that, towards your pocket. And that's kind of roughly where the area where the ball's going to go. Again, you'll know it when you watch the replay, because you'll see your face change when you find the right spot.
Sounds promising.
So yeah, so just moving around. Once you find that spot, you're just going to breathe and just sink into it. We're not going to do any moving here. Again, you can use the leg that's on the ground. You can use your arms to take some of your body weight, so you don't have all your body weight on there. But then what will happen is you'll either feel a lot of pressure where the ball is, firstly. Most people will feel that. Or you might feel it kind of referred down to the side of the knee, a bit of pain. That's normal as well. But then it'll start to subside. And once it subsides, you might feel that it's gone like soft under the ball, so you can move it around and find a new spot. Once that happens, and yeah, just letting it sink in. Do you know how hard it is for me to talk normally while I've got a ball digging into the side of my hip?
I don't know how you're doing it. I'm out of breath just lying here.
Yeah. And so you can now start to, if I demo it, keep on the ball. But if the ball's here lying on your side, you can start to use your body to drag the ball from like the side towards the front, like in those small movements. And as you can see, Dom's doing it 100% correct due to the face. How are you at poker?
Terrible.
All right. Let's flip over, go the other side.
I think my hip's broken.
Cool. So yeah, again, finding that spot. If we've forgotten how to find that spot, so find the bony part of the hip, just drop just to the side and down just a tad. So it's not really bony around there, and that's exactly where the ball's going to go. So on me, it's where my pocket is, kind of where it's going. And then using the opposite leg and the arm to take a little bit of the weight. And once you find the spot you want, just relax, breathe into it. Sometimes easier said than done. Cool. Start the drag, so dragging from the outside of the hip towards the inside of the hip. And hop up, relax. Awesome. All right. Cool. So what you're going to do, you're going to grab your roller. So we're just going to go through some hamstring activation work now, just to get them all fired up. And then we'll add one more thing at the end, and then we'll retest, retest. So what you're going to be doing, you're going to go feet together with this one. There's different grades. Okay, so first grade, what we'll do is we'll keep bum on the ground. And I want you to curl, like so, keep pushing your legs into the roller. Okay, and we're going to curl the roller towards the bum and coming back down. Probably start the roller about kind of on the Achilles, like this part here, just so you don't roll off it. Yeah, so that's the first part. Okay, if that's easy, we're going to lift the bum up. You're going to roll towards you, back down, controlled each time. Okay, if either of those are too difficult or awkward, or you don't have a roller, then what we can do to substitute it is take your feet as far away from you as you can, dig the heels in, and we're just going to push hips up. And I want you to think about trying to pull your heels towards your bum, and you're just going to hold that position. So we've got different options, okay? We've got the hold, we've got the one with the feet, the bum not coming off the ground, or we've got the final one where we're lifting hips and bringing that in, okay? Either one, what we're going to be doing is we're going to be doing either 10 reps or 10 seconds. While you're doing this, so Dom's doing, you're doing the first one? Yep, cool. Either one, if you're doing the first or the second one, I want you to make sure that you're feeling both hamstrings working evenly. So if one's not, I want you to dig that side of that leg into the roller a little bit harder. You feeling that?
Yeah.
Yep.
Especially we've done a few with their hips up. It makes it so much.
Yeah. If you can kind of do a mix of the two, if you're like, if the first one's too easy but the second one's too hard, where you roll it in, so you're doing the first one, and then we can lift the hips up and then try and control it coming out as far as we can, and then the hips will drop. That's like another way we can do it, so you're working the controlled portion.
Yeah, that's much easier.
Yeah. And then, yeah, just go as slow as you can, bringing the legs out away from you. And life's a bit more difficult with you because it looks like you've got a thinner roller than I do, so you kind of run out of space. Yeah. For those playing at home, we could also use the sliders that we used last week for the upper back. You could do the same thing, just have your heels on the sliders and slide in towards you. Or if you're on floorboards, you can just use the socks on your feet, and that should slide nicely on the floorboards as well. So a few options there. Cool. Alrighty. Last one. So we're going to go kneeling like this. Okay. You're going to be on the back toe. Okay. And now what I want to do is I want you to bring your chest over the middle of your foot. And as I do that, what I do is I feel a bit of tension build at the back of this hip and the back of this leg. Okay. Now what I'm going to do is I'm going to do a lunge. So I'll demo. I'm going to do a lunge where I'm coming up, but I'm keeping my chest. You can't see it, but I'm keeping my chest over the middle of my foot. I'm not letting myself up straight. So I've got my chest here now. I want to bring myself forward the whole time. All my weight is on this front leg. So what I'm going to do is I'm going to do 5 slow controlled lunges where it's like partial range, but I want you to feel this and this working, nothing else. Okay. If you're feeling the knee on the back leg, it's because you're putting too much pressure and weight on that back leg. I want you to have more pressure on the front leg. So I would probably even say like 90% on the front, 5 to 10 on the back. Yeah, and then once you've changed, you flip around. We're going to change the other side. So set up again, 90-90, back toe up. Bring my chest over the middle of the front foot, driving that front foot into the ground, keeping my body weight in the middle of the foot the whole time. Again, it should be here and here predominantly working. And 5. Nice. How'd that feel, Dom?
Pretty good.
Awesome.
Weak
So
hamstrings as always.
Yeah, oh, big time, big time. Hamstring's got a beating today in the activation strengthening. So let's work backwards. Let's see how that feels. With knees coming close to the ground.
Yeah, definitely.
Cool. All right. Then we went the squat, the setup, squatting down, moving around, feeling the hips. Don't feel any looser.
Yeah, definitely, especially at the front.
Yeah. And then we had the toe touch. The feet together, going the toe touch. Again, if you touch the ground on the first one, just feeling where it feels different. So it's at the back of the hips, back of the knees. What's stopping you? That's looking better on you, Dom.
Yeah, getting closer. One day.
And then finally was the knee to wall. So setting up your foot. If you put a marker down where your foot was, match up to that. If not, just go off memory and just seeing how that feels with the knee getting close to the wall. Sweet. That's that. That's a nice little post-running routine.
Time for a nap.
I didn't work you that hard, did I?
No, of course not.
Easy. Alrighty. So I'll fix the reminders for the class to make sure they come out on Thursday. And everyone playing at home, Thursday, 1:30, like today was, Tuesday, 1:30. So we're doing every Tuesday, every Thursday at 1:30 p.m. Easy. Thanks for joining.
Beautiful. Thank you very much. Take care.
No problem.